Introducing Herbal Medicine course. This is video 4, part 2, and this video is on inflammation. Inflammation, what is it? The immune system has two parts, the non-specific innate immune response and the slower microbe-specific adaptive response. The innate immune system acts quickly in response to an infection, irritation, or some other injury to bring about more blood and white blood corpuscles to the area, and this is in fact inflammation. Key features of inflammation are redness, warmth, swelling, and pain, and you see a splinter going into the skin here and the white blood cells amassing. The inflammatory process inevitably causes tissue damage and due to toxins, free radical release, but this is normally followed by healing and repair. However, there is such a thing as inappropriate inflammation, and this is related to disease. And this is because inflammation is a double-edged sword, and it always causes destruction of some of the body cells and production of toxins called free radicals, which will normally be neutralized by antioxidants from the diet and the body itself and lead to recovery. However, inflammation can become chronic where the immune system starts to attack healthy cells. And it's now recognized that chronic inflammation is involved in a number of diseases: heart disease, arthritis, depression, Alzheimer's disease, autoimmune diseases. In fact, it is the underlying condition of all disease, one might say. So it's important to minimize inflammation. And how can you do this? So avoiding too much starch and sugar, interestingly, because these are pro-inflammatory, and eat more anti-inflammatory foods, get enough sleep, and reduce stress levels. Weight control. Weight gain increases inflammation. Glucose control. High glucose levels in the blood increase inflammation risk. So this is a risk in diabetes, of course. And we can tell about inflammation through markers. One is called C-reactive protein, or CRP. It's a blood test, and it checks for inflammation, the normal level being less than 5 milligrams per litre. And there is a high sensitivity CRP test, HSCRP, whose normal level is 0.3 to 1 milligram per litre. And some people are insisting that this one is the one that we should look at, even in the absence of a high or raised C-reactive protein. So what are the worst foods for inflammation? Too much of the following. In the fats section, too much omega-6 fatty acids. These are found from oils, seed oils like sunflower oil, and margarines made from them. Trans fats, which have been made into hard fats using catalyst. For example, you get them in some biscuits and hardened margarines. Starches, and particularly those in refined carbohydrates, baked goods, example pies and pastries. And sugar itself, sweets and chocolate, sweetened beverages and drinks, soft drinks, for example, cakes. And what are anti-inflammatory might not surprise you. Top of the list, fruit and vegetables for their antioxidants. Plant chemicals are hugely important. I'd put them at the top of the list. But coming close second is omega-3 fish oils, because this is a very important anti-inflammatory item in the diet, and it needs to balance with the omega-3 fish oils, did I say 6? And it needs to balance with the omega-6. Cut out seed oils with omega-6 and substitute olive oil, and eat oily fish 2 to 3 times a week, and use capsules of omega-3 to boost it up if necessary. Vitamin D at higher levels in the blood, higher than regular targets, an anti-inflammatory effect kicks in. So plenty of sunshine on the skin in the summer will make loads. But if you don't get that exposure, and it's got to be directly on the skin, you still might even supplement in the summer. Vitamin D supplements in winter. I personally take 4,000 international units per day in the winter. And then there are herbs, of course: turmeric, ginger, garlic, chamomile, marigold. In fact, all herbs actually, and in all plant material, is inherently anti-inflammatory. Some are more so than others. So we have the willow bark, green tea, rosemary, cinnamon. These ones are more than you might expect from an ordinary plant material. To summarize, then, inflammation is part of the immune system. It's part of the innate immune system. But chronic inflammation means that the immune system does not switch off properly and gives rise to various diseases. You can minimize inflammation by avoiding foods high in starch and sugar, and keeping a good body weight, a good weight for height. And eat an anti-inflammatory diet with fruit and veg, omega-3 and vitamin D. And of course, there are many herbs that are strongly inflammatory, and they can add to that. So I think that will give you a little bit of an insight into a very important concept. I feel it's one of the most important things that one has to consider when seeing a patient, for example. Is there any evidence of inflammation in their body? Do they have any arthritis? Do they get headaches? Any skin problems? Inflammation can occur in any part of the body, including the brain. So I hope that's given you a little insight, and thank you very much for listening. Thank you.